Is a 50% heart blockage dangerous or is it manageable with medications? Friends, I am Dr. Toishi Sharma, and today let's talk about a very common question that patients ask me. If I have a 50% blockage in my heart artery, is it dangerous? Can we manage it with lifestyle? Let's break this down clearly. So, what does a 50% blockage mean? A heart blockage means narrowing of a coronary artery due to atherosclerosis, which means a plaque made up of cholesterol, calcium, and inflammatory cells. When we say a 50% blockage, it means that the artery is narrowed by half. And this is considered a moderate lesion. Now, at this stage, blood flow is usually adequate at rest and even with most activities because the artery can still supply blood to the heart muscle. And that's why many people with 50% blockage do not have major symptoms. Now, let's talk about, is it dangerous? A 50% heart blockage is generally not severe enough to need a stent or a bypass surgery. However, it is important to know that if the 50% heart blockage is in the left main artery, then it is still considered significant. But in other arteries, it is considered moderate. Even though it is not a severe plaque, it can still rupture and cause a heart attack. The vulnerability of the plaque, whether it is inflamed or unstable, is sometimes more important than the exact percentage. So yes, it is a potentially dangerous plaque over time if it is ignored, but it is usually manageable without procedures and we can effectively stabilize this plaque with medications alone. Now let's get to the question, can lifestyle changes help? Absolutely. A 50% blockage is the perfect wake-up call to change habits and prevent it from becoming worse. What helps the most is medications. Everyone should be on a statin medication to stabilize the plaque and aspirin as well if it is recommended by your doctor. As far as a diet is concerned, you should definitely cut down on carbohydrates and fried fruits. Increase your intake of fresh fruits, fresh vegetables, whole grains, nuts, and olive oil is a better option for you compared to other oils. With regards to exercise, at least 150 minutes of exercise per week is necessary to keep the dynamism in your body and reduce inflammation as well as cholesterol. Also, if you smoke and are found to have a 50% blockage, please stop smoking because smoking causes inflammation and this can result in a heart attack. And also make sure that your blood pressure is checked regularly. If you have diabetes, your hemoglobin A1C is under control and your bad cholesterol, the LDL cholesterol, is less than 70. Why? Because uncontrolled blood pressure, uncontrolled diabetes, and uncontrolled cholesterol are the major reasons why a 50% blockage can become a 90% blockage or why it can rupture and cause a heart attack. If you have a 50% blockage, you should regularly see your doctor and your cardiologist at least annually for a clinical history to reevaluate your symptoms and an examination. And at that time, it can be determined by your physician whether or not you need any kind of testing or not, depending on your symptoms and examination. So friends, a 50% blockage is usually not an emergency, and in most cases, it can be controlled with medications and lifestyle changes, but it is a warning sign. Your arteries are telling you to act now. And remember, it is not just the size of the blockage, but the stability of the plaque that matters. With the right medications and the right lifestyle changes, you can prevent that 50% blockage from ever turning into something more dangerous. Thank you for watching. I'm Dr. Toishi Sharma. If you found this helpful, please like, share, and subscribe for more heart health insights. I will see you in the next video.